The following program does not necessarily represent the views and opinions of Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Welcome to the Bear Psychology Radio Show with psychologist, author, and speaker, Dr. Anna Baranowski, where mind, mood, and what matters to you are discussed. We're broadcasting live from Toronto, Ontario, Canada, on Reality Radio 101. Send us an email right now. Our email address is instudio101@gmail.com. And now, right to your host of the Bear Psychology Radio Show, Dr. Anna Baranowski.
Hi, everyone. I am so glad to be with you here again today. And we have a very interesting show with a great guest, and I'm really, really pleased about it. I just have to say, if you have an interest in psychology, mental health, or emotional wellness, then you've likely heard about CBT, or as it's known, cognitive behavioral therapy, an approach that is positively supported by thousands of research studies and is seen as the gold standard for many different treatments of depression, anxiety, trauma. You know, it is absolutely crucial to know about CBT if you have an interest in mental health recovery. And what I believe is that we have to look at health and our overall well-being through many different windows in order to allow ourselves to come up with something that will work for us from where we are right now and what we're facing. Now, of course, we're facing some pretty strange times, and we have to be broad in our view of what might be beneficial at this precise moment in time. You may have, one idea, mindfulness meditation is really the way for me to take care of myself, or maybe you like to run, or you're into hiking outdoors, or you believe only in group therapy, or you believe only in sitting with your personal therapist in a private room face to face. Whatever you think, let's just see if you can open your eyes a little bit today and consider what might happen if you considered CBT as part of the recipe that might be beneficial for you. And I know that, I've heard it from many people. I work with a really kind of broad spectrum of clients in my practice. And, sometimes what I hear from my clients is that CBT didn't work for them. And, I know that's true. CBT doesn't work for everybody, but I think it's really important to recognize that there are many ways to apply CBT and not to feel like you have to get stuck in any one box or any one approach. And today we're really fortunate because we have Nina Josefowitz, and she is an expert author on this topic. She's the author with her husband, David Myron, Dr. David Myron, and they wrote CBT Made Simple, which is now in the second edition. Now, this is actually a clinical book, but I'll tell you, because I've been reading it, and I can tell you that the book actually is so well written. It's got such great different approaches to work with that I can see a lot of people in the community getting some benefit. However, I would like to encourage Dr. Josefowitz to actually figure out if she could write something that is for the public, because the book is written in a way that is really adaptable to people who maybe don't want to come to it from the background of a clinical approach, but it's a great book. So I want to just start by telling you a little bit about Dr. Josefowitz, and then I'm going to move on. Dr. Josefowitz is a psychologist. She's a CBT therapist and a teacher for over 30 years. And I had a previous conversation with Nina, and we talked about her traveling all over the world, teaching about CBT, and what a remarkable thing that was for her to do. Unfortunately, none of us can do anything like that today. With all of the lockdowns that are going on. We are currently in a third wave of COVID right now in Toronto, where we're located. And a lot of people are talking about the increased struggle of this. And as a matter of fact, people who were doing actually quite fine in the previous two waves are struggling more now than they did previously. Nina and I are going to talk about that a little bit, looking at it through the lens of this very popularized buzzword, languishing. So we're going to include that today as well. And Nina's going to help us by understanding both what languishing is and what CBT is, and what makes it such a powerful approach. And we're going to look at things through a behavioral activation lens, because I think that's really important. And Dr. Josefowitz and I were just talking about how important that piece is. Now, the other thing I want to tell you about the book that Nina wrote is that there is a ton of online material that comes with the book. There's downloadable forms that people can fill in. And the other thing that was really nice in looking at the book and seeing what resources were put in place is that there's a lot of videos that show kind of the use of the tools. So you get to see things in action. And well, I want to just start by thanking Dr. Josefowitz for joining us today. And welcome, Nina.
Anna, thank you so much for the lovely introduction. And I'm so pleased you liked my book. And I actually agree with you. It was written for clinicians. I know many, many people who are either struggling with mental health or just sort of feeling things are kind of heavy and tough these days, who've read it and have told me they find it hugely helpful. Mm-hmm. So thank you very much. I appreciate it.
Yeah, my pleasure. Well, I really appreciate what you did with the book. I think that it's very well put together and organized. And I think that's really helpful when people are trying to understand, these concepts. And I can, from what I see from the book, it's really not just for beginning therapists or beginning CBT therapists. It's just a really good reminder of some practical things that, often, when we're busy in our clinics or, involved in complexities, sometimes we need to go back to materials we may have been familiar with in the past and actually kind of rethink things or, recall things that we might not have used for a long time. And we may find because of either, where we are in our career or what's happening in the world, particularly now. So I'm so happy to have you on the show today, that, we might need to go back to it. And this is a great book to do that with. I wonder if we could start actually by just with a really, really practical, kind of friendly way of our listeners to understand what is this thing called cognitive behavioral therapy and why might it be useful for them as members of the public, or, because we have a lot of professionals who listen to the show, as well as members of the public.
Okay, so let me give you a very sort of brief overview. When people experience difficulty, they're often either really aware of their feelings, they're just anxious, feeling down, feeling overwhelmed, or they're really aware of what other people have done to them. My sister-in-law is impossible. My partner doesn't treat me well. My kids don't listen to me. Neither of those give you much of a place for starting to think about how can I make my life better? How can I change things that are under my control? And what CBT is it's really a structure that when you're distressed, or even if you're happy, but it's a structure for helping you understand what's going on inside of you. And I want you to imagine a circle. And to the left are feelings. Up on top are thoughts and images. To the right are physical reactions, and to the bottom are behavior. And we look at these 4 factors, and we look at how they all interact. So let's say I was hoping to get on a Zoom call with a friend. I get on the Zoom call and they're not there. That's the situation. Maybe I'm feeling really depressed because of that, just kind of a down feeling. My thoughts are, my friend doesn't care about me. It's those thoughts that drive the feeling of depression. As I'm thinking my friend doesn't care about me, maybe I feel kind of heavy, lethargic, don't feel like doing anything. I check out of the Zoom call and go eat a piece of chocolate cake in the fridge.
Right. I like that example. Yes.
Right.
Yes.
So it's kind of, you want to understand these 4 factors.
Beautiful. Okay. So now I know that there's actually a 5th factor, the circumstance.
That's right. It's the situation.
Yeah. So can you add that in a little bit more in terms of kind of, let's say we are dealing with COVID, people are dealing with something that, you know, is a incredibly big, like a life-altering event in society in general. I mean, it's not just a personal thing. It's encompassing everybody. So let's say it's the same situation that you just described now, but on top of that, this person has lost somebody because of COVID. Maybe they're in the process of losing a business or a home because of their finances as a direct result of COVID. How do we add that bigger, you know, reality into all of this?
So really, really good question. And I think every therapist would answer it differently. What I would want to take a look at is, what does COVID mean for you? And what are the ways that it's impacted your life? Some people have lost businesses, but some people haven't. Some people are not seeing friends, but some people are taking long walks with friends. Some people are doing online education. For some people, they like it. A lot of people hate it. So I want to start by trying to really understand, what have the changes been for you? And then I think we want to do sort of a 2-pronged, I don't know if the word's intervention, but kind of what can I do about it? The first is problem solving. You know, if you've lost a business, that's a real problem. And there are real financial consequences. And you need to sit down and figure out, what can I do about it? If you can't see your friends the way you normally could, and most of us can't, what are the options? What are some things we could do about it? And then you want to take a look at the 4 factors I talked about earlier. What are my thoughts? How's that impacting my mood? Physical reactions? And then, what am I doing? How am I coping with this? And is it helping or not?
Beautiful. So, you know, the part that I really like about this is that it addresses things in a really, really practical way. Now, some people have that down pat. You know, they know how to do all the practical things, and they're action oriented, and they, you know, they're good with it. But this is such a good starting place when this capacity, you know, dealing with the what can I do about it is not a strong skill set.
Yes.
And so I think that, you know, it fills in a gap for people who need just this particular kind of language. And that's why I kind of like to keep in mind that we have to use all the tools that are available. And CBT happens to be one of those tools that's super practical and gives you structured mechanisms. Let's go to some of our listeners right now. See, I find this very, very interesting. This is from Carla. And Carla is asking, good afternoon, doctors. This is an interesting topic. Is CBT a new type of behavior therapy? Thanks. Now, don't you find that interesting, Nina? I mean, you and I know that CBT has been around for so long and is one of the gold standard approaches. And there's been more research done on cognitive behavioral therapy than any other therapeutic approach available. What are your thoughts about that? And can you explain a little bit about the history of CBT? Because it goes way back.
It does go way back. And in a nutshell, what you have is, let's say 1950s, 60s, everyone was doing psychoanalytic psychotherapy. You then had Skinner, who came along, who was very behavioral, really looked at what is reinforced. And so, for example, is seeing a friend, you do it or you don't do it because of a positive consequence. And Skinner said your thoughts, your feelings were irrelevant. And around 1975, 76, Aaron Beck came along, and he said what really matters is your behavior, what's reinforced, but also what really matters is what you think or how you understand a situation. So, for example, do I understand Carla's question as, boy, this is really interesting. She must be really smart, which is what I think, and I'm eager to answer the question. Or do I think, oh no, she's trying to trip me up, in which case I feel kind of anxious and not so great. So Aaron Beck really focused on the importance of how we understand a situation in terms of its impact on our mood and behaviors and physical reactions. It's been around a long time, but some people have heard of it and some people haven't.
Yeah. The part that I find really interesting is that I think people don't know about CBT unless they're kind of within kind of this work. And that the reality is in some ways, even though it's such a well-researched kind of area of treatment, in some ways, I think there's a lot of misconception about CBT, and it's not as well understood or even necessarily utilized in the ways that it can be, because there's so many different elements of CBT. Like we had a conversation previously where I was describing the kind of work that we do, and it's more like somatic cognitive behavioral therapy. And we also deal with the thoughts, the feelings, sensations, and behavior. But, you know, it's within the context of a trauma-informed care mechanism, and how to use CBT within that mechanism is necessarily different than the kinds of approaches I might use with somebody who's coming initially for, you know, like a low-grade depression, or kind of core beliefs that are undermining how they see themselves in the world, or their interpretations of the interactions they have with people around them, or the world around them, or the circumstances that they're dealing with. Yeah.
Really, I totally agree. You know, you said something really interesting, Anna, which we haven't talked about, and I would like to talk a bit about, which is the idea of core beliefs. Because I think it's really important. And if it's okay with you, can I spend a minute or so just explaining it to your audience?
Oh yes, please. And it's such a huge piece of work, and actually something that I look at a lot therapeutically because it's really important.
Totally agree. So let's say you're raised by a loving mother and father, lovely childhood. You develop a core belief of, I'm a good, okay person. The world is safe and people will treat me nicely. You go out into the world and you want to be my friend and I'm not very nice to you. You're likely to think, oh, what's the matter with Nina? Or not everyone's going to like me, but it's not going to really upset you in a very deep way. You grow up in a family where you were highly criticized. Maybe there was some form of abuse. You learned that you are not a good person. You're not a worthwhile person. You learned that people will take advantage of you and that people will not like you. As an adult, you go out into the world and for whatever reason, you meet me, I'm not very nice to you. That confirms your beliefs about yourself. You notice it and it really upsets you because it just gets into your core. So it's these core beliefs that both determine what we notice. They also determine how we interpret things. Because let's take the first person, happy family. They say, Nina, let's get together. I say, I don't know, I'm busy, but another time. You interpret that as, I like you and let's get together another time. Second person who grew up in a family where they were highly criticized. They say, Nina, let's get together. I say, I'm sorry, I'm busy, but another time. You think she doesn't really want to see me. She doesn't like me. It's because I'm no good. So the core beliefs really influence what you remember and how you interpret events, because most events are just not that clear, especially social events.
Absolutely. And I think it's easy when you have this uncertainty that kind of got woven into your inner infrastructure, that you see things through a certain lens.
Yep.
And it becomes very difficult to come up with something other than the old belief system. Mm-hmm. And that's where CBT is really, really strong. Can you talk a little bit about that?
Yeah, I think you're right. I think, first of all, one of the things that happens, and with these old belief systems, I think of them as magnets. So if you think no one likes me, you walk around the world noticing times when you could interpret it as people don't like me. And any evidence that people do like you is just somehow sloughed away and given no weight. A lot of what happens in therapy is you with your therapist, you work at figuring out what are your core beliefs. What's going on that you're feeling so bad and interpreting the world this way? And then you work together at taking a look at, are there other ways of seeing the world? What is your interpretation? Is it necessarily accurate? Are you looking at all the evidence? What's another way of looking at things? And as you start to do this in therapy, the possibility of another interpretation opens up. And then the possibility of reacting differently opens up and things start to change.
Yeah. And that's what makes it really powerful, is that you get to peel back those old layers and start to come up with new alternatives for thinking and practicing thinking. Mm-hmm. We've got some other emails that are just coming in, so let's take those as well. This Definitely. Is from Dave, and Dave says, hello today. Isn't CBT actually what psychologists used for therapy? I thought this is what treatment options were from psychologists.
Okay. Yeah. I love his question. Really, really great. So I would say that's what good therapy should be. Absolutely. I think what can happen And I don't want to put down other forms of therapy because I totally agree with you, Anna. There are a million portals to feeling better. It's not like anyone who tells you this is the therapy I do and it's the only answer, don't trust them.
Yeah.
But what can happen? What's the difference for CBT is it tends to be more active. So whereas I would want to know what was your childhood experience, and we would want to take a look at what kinds of beliefs about yourself, others in the world came out of that, I would also very actively want to help you change. So I would teach you techniques to challenge your automatic thoughts. I would teach you techniques to help you start to problem solve. I teach you techniques to face the issues you've been avoiding in a very present, focused, let's get some changes in your life kind of way. And I think that's one of the real strengths of CBT.
Yeah, it is. It is absolutely. And, I will just say this in terms of the question from Dave, which is actually a really good one. I think people come from a lot of different training backgrounds, and it's not all called CBT for sure. But most skilled clinicians know about cognitive behavioral therapy and include it in their work, even if what they're doing right now isn't specifically called cognitive behavioral therapy. Like I work with a lot of different interventions, and some people wouldn't look at it and think this is cognitive behavioral therapy per se, because we do a lot of kind of deep trauma processing work. Some of it would not be necessarily called CBT, but actually it does offer a kind of CBT component. Mm-hmm. And, it gives people the opportunity to do the practical work of making sense of, looking at core beliefs, working through very devastating, traumatic experiences through a somatic, that's a body felt mechanism for cognitive behavioral therapy. And, I think that this behavioral activation piece, without it, I would not feel that the work that I was doing either would be sufficient. I use a triphasic model, which is always working to start with stabilization, and whether that's stabilization in your thoughts, your feelings, your sensations, or your behaviors. It takes a CBT model, even though I might give somebody a process breathing exercise to teach them how to lower physiological arousal. But it really is still a CBT model. Whereas then the next phase takes a processing trauma model, where you're really, really deeply working through the experiences of trauma in a titrated layering approach, which is really kind of approaching the trauma, working through it in ways that you can, dealing with the impact on your body, and then going back to it. So you're going back and forth without overwhelming the individual. And then actually the third phase is always kind of reintegrating into the world and becoming active. And it's your behavioral activation approach. Because without that piece, people feel actually kind of lost. So it's like, okay, I'm feeling better. What now?
Yep.
Right.
Totally.
Like, there has to be some respect for what now.
Mm-hmm.
Right. Okay.
Totally.
Let's look at the next question. So this is from Fret. And Fret says, hello, what a topic today. Excellent. Can CBT used for all psychological issues? And if so, what are the different therapies of CBT? Oh, that's a great question.
A great question.
Oh, that's really good. Okay, go ahead, Nina.
Okay, so I want to answer this in two ways. One is I'm going to answer the question, and the other is I'm going to ask your audience to play with, not play, but to follow along with me a little bit and try CBT on themselves.
Okay, so, I'm up for that. I'm doing it too.
Okay, excellent. Okay. So first of all, can it be used with all psychological issues? It started out as a therapy for depression. It's now the gold standard for all the anxiety disorders, OCD, obsessive compulsive disorder, post-traumatic stress disorder. And I think you did a great job talking about your own treatment and how you use certainly aspects of CBT, panic disorder, social anxiety. It's used for eating disorders. It's a component of couple therapy. It's often a component of therapy. It's the basis for substance use disorder. With people who are severely struggling, it's often used in conjunction with medication. At this point, I would have trouble thinking of a human problem that CBT would not be a component of. Though you would modify it. So for example, the description of working with trauma that Anna just gave you, it's different than the way I would use CBT for someone who was depressed. And it's different if you were socially anxious. And also which intervention I would use would depend on how severe your symptoms were. So I hope an answer in a nutshell to the question. I would like to sort of encourage your audience to see how this might work for yourselves. And the first thing I'd like you to do is, I'm on the radio, I'm not with you. So please don't pick a situation that is just horrible because you're alone, you're in your home. That's not fair to you. It's not what we want. But pick a situation which was sort of, like a 5 or a 6 out of 10 of distress and see what it's like. So first of all, pick the situation and allow yourself a moment to really go back there. Maybe it was your text didn't get answered. Maybe you're struggling with some online learning. Maybe your boss didn't like a report you did. Think of something that happened. And then I want you to first take a moment to identify your feelings. And just think of one word that is a feeling. Were you sad, distressed, anxious, frustrated, overwhelmed? And kind of just think of that feeling and give it a label. And write it down, actually. We do a lot of writing in CBT. And then I want you to think, as you had this feeling, what was going on in your body? Were you tense? Where were you tense? Were you was it a heavy, tired feeling? Was it a headachy feeling? Did your stomach get a little churned up between your shoulder blades? Did you get teary? And kind of note what was happening physically with you. And then I want you to take a breath and say, okay, what were my thoughts? And in particular, what were your thoughts about you? I'm no good. I can't manage. I always fail. I never do what I think I will. What were those negative thoughts about yourself? Any negative thoughts about other people? My boss won't like me. My friend didn't like me. Thoughts about the future. Things never work out. This is always going to be awful. Just take a moment to notice your negative thoughts. And then ask yourself, what did you do? And see, does it shift anything for you to just look at these 4 factors? And then I'm going to ask you to do something, in therapy, what we just did in 2 minutes, we'd spend a good 20 minutes on really helping you identify these 4 factors. But the next step we do is pick one of your thoughts. One of the thoughts that's kind of hard to say, I'm really thinking this, and ask yourself, what's the evidence? Is there another thought that might be true? If this is the worst case scenario, what might be a neutral or better case scenario? And see if you can just get a little bit of distance between yourself and your thoughts and see if that makes a difference to you. So I leave that with you to kind of try for yourself right now, or after our radio show's over.
Now, I love this because it's so super practical, and I was writing down all the things you were saying furiously, but I want people to know that they can always download this radio show. It always becomes a podcast after, and it gets uploaded to both Bear Psychology podcast as well as the What is PTSD YouTube channel. So for sure, you can listen to this afterwards. And I just like how structured you are in that kind of explanation and the questions that you use. It really kind of pulls you into this self-exploration, which is where we really all need to do. This is about accountability. It's about you taking ownership, and that ownership alone can really reinvigorate you and give you that feeling of like, oh, okay, good. I could really start focusing on what's going on for me. Very powerful stuff. I love it. If people are interested, absolutely. If you have questions or comments or just want to kind of give some feedback, instudio101@gmail.com, and join the conversation so that we can keep moving forward with this. So that is fantastic. Now, let's move forward and see if we can hear from some others. But before we do that, now we have quite a few emails today, and I want to just say one thing. Before we got onto the line, Nina and I were talking about this very popular buzzword, languishing. And languishing is really, really in the news right now in terms of what's happening to people all over the place as we're going into, the third wave of COVID and, lockdowns and, just how difficult it is to continuously kind of, start doing things and then stop doing things. And the feeling that you've gotten, what is this languishing thing? And I'm going to just say there is a fantastic article that is available online, and it's called, there's a name for the blah you're feeling. It's called languishing. It's a New York Times article, and it was written by, I think it's Andy Grant, a psychologist. Yes. And it's actually really interesting because there's an article, but there's also a 9-minute recording that you can listen to of Andy speaking about. Sorry, it's not Andy, it's Adam Grant, and it was published April the 19th, and it has just been viral. People are so interested in this. So first of all, let's just say that it's a pretty interesting topic. And Adam says, at first, I didn't recognize the symptoms that we all had in common. Friends mentioned that they were having difficulty concentrating. Colleagues reported that even with vaccines on the horizon, they weren't excited about 2021. A family member was staying up late to watch National Treasure again, even though she knew the movie by heart. And instead of bouncing out of bed at 6 a.m., I'm lying there until 7, playing words with friends. It wasn't burnout. We still had energy. It wasn't depression. We still feel hopeless. We just somewhat feel joyless and aimless. That's what Grant says. What are your thoughts?
I think he really captures what's happening to a lot of people. And the way I see it is, one of the things psychologists talk about is most of us have a pretty steady level of where we are in terms of the happiness scale. We tend to be people who are, pretty optimistic and happy. We tend to be people who are medium, maybe on the low side, but, we kind of go along, some days are better than others. We kind of go along at our usual level. What's happened with COVID is many of the things that support us have been taken away. And when that happens over a long period of time, our general level of contentment just goes down a couple of notches. Mm-hmm. So we're kind of less enthusiastic about everything. We're not depressed, right? But it's just a kind of lethargy. things feel hard to do, hard to get going. We don't look forward to things, but there's a bit of hopelessness like I hear people saying, is there going to be a fourth wave? Boy, will we really get vaccinated ever? So it's this sense of, not doing terribly, but just things aren't really great. It's like you're down a level from your normal way of being. And it comes from this sense of, it wasn't just one assault, right? It's been a year. It's the length of time of kind of the low level drip of difficulties.
Yeah. And really for, people in North America, it's kind of the first time in our generation that we've actually had to face this level of catastrophe.
Yes.
On a global platform, to be involved personally on that global platform of catastrophe.
Mm-hmm.
Yeah.
I think you're right.
Yeah. Nina, let's go back to our listeners and hear what they have to say.
Okay.
This one is from Joyce, and she says, "Good afternoon. My question to you is this. Are there any limitations to using CBT? If so, when would you not use CBT?"
Well, you're getting great questions.
We have great listeners. I have to show you.
Totally.
I want to say this just in response to this. I just want to say that in terms of this whole languishing thing, and also in terms of the listeners on this show, this is one of the things that I do that to me is a real bright point of my month, and I look forward to it. But what I really, really enjoy is participating with both the guests like yourself today, Nina, and also with the listeners out there in the community. It's so nice. And especially now during COVID, it's even nicer. Okay, I leave it to you.
Okay, Anna, I want to answer the question because it's so good, but I want to pick up on what you said about languishing and, for you, the joy of listening to, of doing this radio show. People are languishing because of a drip over a year. There's no quick answer to it. I personally believe that once our normal lives return, and we can get out, see friends, put some of the building blocks back into our life that gave it some of the joy before, people are going to be feeling better. But in terms of right now, if you can find even one thing that engrosses you, where there's a little bit of a spark and you kind of feel, oh, that might be nice. A lot of people, it's cooking. Like, is there I wonder what it's like to do this new recipe. For some other people, it's, going out and getting out into the park. Maybe there's, something you've wanted to do for a while. Anything that gives you the beginning of that would be nice. See if you can make it grow. Yeah. See if you can start to do that a little more.
And it's a good lesson in life as well, because there's this piece around just allowing yourself to enjoy the simple things of life and to let yourself really be with those moments and notice them, really, really notice them. I am going to respond, Joyce.
Yes. Oh, that's right. I don't want to forget the question because it was so good.
No, it is really good. And I want to respond, Joyce, because one of the things that you're kind of really bringing up for me is a particular way in which I work with the more somatic CBT approach. And the trauma processing piece, which is not, there's a place where it becomes very, very important to attend fully to the unfolding of the emotional pain that somebody might be experiencing, and to really deeply allow a leaning in toward that pain. So somebody could actually learn how to become friendlier with themselves around their own, the place that is wounded inside, and to learn how to navigate that and leave space for it. And that's the piece I find that is not really particularly addressed in the standard CBT approach. And that's okay. It's just, recognizing that it's really important to have a very broad skill set as a psychologist to understand in what moment should you and can you successfully, well, we might hope successfully, apply an intervention that we believe, that we see that there's a space for, a place for. And in the moments when somebody is dealing with deep grieving, I wouldn't be asking them to do anything necessarily that's just challenging their thoughts or their core beliefs, or, moving on with something behavioral.
Mm-hmm. Anna, totally agree. One thing I also wanted to tell your audience, if you go to my website, and all you need to do is do www.CBT Made Simple, you'll get there. I've got a series of blogs which will give you a sense of how CBT might react to different issues that people have, whether it be around depression or anxiety, or social anxiety. So that is also, Joyce, when you say limitation of CBT, how is it used? It would give you a bit of a sense.
Yeah, that's fantastic. And I know your material is so well resourced and put together that I think people would really enjoy it. And just so people know, if you're going to go through the blog or listen to this again or share it with somebody, it's available at traumapractice.org under our resource section with the blog and radio show. And then also you can just go to Bear Psychology Radio show on it's an iPod. It's on iTunes. So you'll be able to listen to the podcast or on Libsyn. So it's posted there, or YouTube /whatisptsd.com. And then what you'll find is that the links to Nina, how to get to Nina, and all her resources are on the blog as well. Here's another email. We've got a lot of emails today. This one's from Laura, and she says, thanks for the topic today. I'm learning quite a bit. Would most family physicians know about this type of therapy for a referral? Is it something recommended in a mainstream medicine? And I would just say, Laura, if you get a referral to a psychologist or, a skilled, registered, regulated mental health practitioner in your community, you could ask them directly, if they use any CBT approaches. And not everybody will say yes, but many people in the community, mental health community, will have some CBT training. And if they don't, and that's the approach you want to use, it's fairly easy to find that out, because most people have a website or some web pages that are linked with a larger organization, and they should indicate whether they use a CBT approach or not. Or you can read up a little bit about the individuals, or just send them an email and ask, or call them and ask, do you use CBT in your practice? I think it's really important. If this interests you, then I think it's really important for you to definitely find that out. I wouldn't say necessarily that your family doctor would know which therapists to send you to who use CBT. But if you go in your local community, there is most likely a psychology organization or social work organization or a counseling organization that regulates and registers mental health practitioners locally. And that's where I would look. And then usually you could find details about the practitioner in that context. Anything else you want to add regarding that, Nina?
Nope, I thought that was a great answer, Anna. I think we're totally on the same page.
Yeah, we are. I noticed that in our first conversation.
Yeah, totally.
Here's another one. Patty. Patty says, hello, can you do CBT therapy on yourself, or do you need a professional to help you? Nina, why don't you take that one? That's a good one.
I love the questions that are coming in.
I know.
So, Patty, I think it depends a lot on yourself, how much you're willing to kind of push yourself, and also depends on how severe your problems. If you're someone who's had severe agoraphobia for years and hasn't been out of your house, the chances of helping yourself are not impossible, but it'll be really, really hard. If you're someone who's languishing, if you have a mild depression, you're somewhat socially anxious, absolutely. I think you can help yourself. There are some really good self-help resources out there. I do think my own book can be very, very helpful to people. Again, it's CBT Made Simple. Some of the resources that are aimed particularly at self-help for anxiety, I think one of the best books is Marty Antony, Antony, the Anti-Anxiety Workbook. It's put out by New Harbinger. Mind Over Mood by Christine Podesky and Greenberg is fabulous. And then you can Google there. I'm just blanking on there's a fantastic website. It's called the Center for Clinical Interventions, put out by the Australian government. And if you go to the website and you click workbooks, they have a list: depression, social anxiety, eating disorders, really meant most of the kind of difficulties people have. And they offer, I think they're usually 8 modules of a step-by-step intervention that are really great.
And remember, there's a lot of apps that you can download to your smartphone that can help guide you step by step. And there are a lot of websites that have program deliverable applications that, guide you through, and in some cases even give you kind of remote support or text support from a professional who can kind of, give you some feeling that somebody's watching or, helping guide you to the next step. A little accountability, which goes a long way. Like there's Bounce Back in Canada, and there's a lot of other ones, and we use the trauma recovery program, which is a CBT approach, but it's an online program that lasts for 7 weeks, and it gives you video stabilization exercises and all sorts of things online. So there is a lot of stuff that you can do for yourself, but I would just caution that if you find that you're getting into this material and you're either getting worse or it's really not helping, go and get help. It's great. Yeah. It just makes a huge difference, because sometimes you cannot see what you cannot see, and just know that's okay. Sometimes it's just really, really helpful to get a professional involved. Here's another one. This one's from Shane, who says, hello, have either of you noticed that CBT therapy has picked up, this is in quotations, so to speak, due to patients' issues with COVID? I am very curious about that. Is there a set therapy of CBT for COVID that is used on all patients? Thank you. Ooh, that's a really good question.
Really good point. Yeah. There isn't a set form of therapy. There are some general guidelines. Part of what bearing with COVID is, and it relates to this idea of languishing, it's how do you help us all become a little bit more resilient to the losses and changes? And one of the key points is, Anne and I have referred to this earlier, it's called behavioral activation. What it really involves is taking a hard look at your life and thinking, where are the points that I can do more of things that will give me either a sense of mastery or pleasure in my life? Yes, you can't go to a friend's house, but what could you do? Could you go for a walk with a mask? Could you do a Zoom call? Could you do some texting? Maybe play some games online? of trying to really think, okay, what, given the constraints of COVID, rather than sitting there and going, I hate COVID, this is awful, to really say, what could I do to either add mastery or pleasure to my life?
That's beautiful. Yeah. And it's not easy. Hey, listen, no. I mean, I want everybody to understand that, you know, in this third wave, by the way, in this third wave, there are some things that I have had to let go of completely because I do not want to become part of the problem. I don't want to put anybody I really care and love at risk. So I've had to curtail some of my activities and, you know, and that's not been easy. So I want you to understand, I don't think it's easy.
No,
I'm not loving COVID.
No.
You know, it's like, it's not easy. So, you know, the thing that I've had to do is to step back a little bit more than I usually do and try to do exactly what Nina had just said, which is really, really try as best as I can to figure out, is there a small thing that I could do that would be meaningful for me? And, you know, one of the things I'm noticing is that I'm thinking about learning language and I'm thinking about, you know, I take this great yoga class online and, you know, it's like, I mean, there are little things, all you have to do is just insert a little thing that you can then look forward to. That's it. I mean, there might not be more than a little thing to start with. But, you know, thank you for that question. It is a really good one. I don't want anybody out there listening blame themselves. If, you know, you're struggling during this time. We're all struggling a little bit during this time. That's not an unusual thing. These suggestions are only ways, tiny little suggestions for you to maybe uptake and challenge. You know, is it really going to be terrible forever? Because sometimes, you know, when we have those kinds of inner core beliefs, oh, this is never going to get better. That's more about something you may have been carrying around for a long time, and to really challenge, is there rigidity in the belief system? And that can lock you into a very, very dark place. And I want to warn you about that dark place because that's the piece that isn't necessarily accurate. And so that's where you start to say, what can you do that is very small and achievable and concrete? And this is another thing I really love about CBT. It's concrete, it's achievable, it's about now, and it doesn't have to be big. It can be very small, step-by-step stuff. And you really lean in towards that tiny little piece that you did that was helpful. And it may be a 15-minute walk once a day. That's it. That's your accomplishment. Fantastic. In those 15 minutes, you think about it, you feel it, you let yourself be in that action and just notice.
You know, Anna, what you've said is so crucial. And there's a piece of it I want to make sure we don't forget, which is the be kind to yourself. This is hard. You know, COVID is hard. All these restrictions are hard. It's hard to pick yourself up and go for the 15-minute walk. You know, be kind to yourself, be compassionate to yourself. I think the trying to do something important and the self-kindness also really important.
It is. I mean, one of the things that I really love are the self-compassion practices. And that's, you know, something that has become very popular in the last 10, 15 years, recognizing that we could really focus on being kind to ourselves in a very specific way. We have a couple more emails. Let's see if we could do at least one or two more. This one is CBT different for children versus adult patients? And if so, how?
Okay, let me give you a quick answer, which is the theory is the same. It's often adapted though, so that instead of talking, you play, or you do fun exercises with a child. And you scale it down to their level. So it's something they can understand. It is extremely effective with kids. So yes, definitely can be used with kids. Similar idea.
Yeah, and kids are often more open because, they don't have preconceived ideas about what CBT may or may not be, whether it'll work, whether it's crap. They have a certain kind of openness to these kinds of things. Nina, it's been so great to talk to you today. We have about 2 minutes left, and I'm just wondering, is there anything that we didn't cover today that you'd like to say, in closing, kind of to wrap it up, or to kind of give our listeners kind of just a piece of your wisdom before we finish today?
Oh, thank you, Anna. I would say 2 things. One is today, if you notice a dip in your mood, take a breath and say, okay, what were my thoughts? Are they realistic? Another way of seeing things. And then pick up on what Anna just said at the end and think, is there a really small thing I could add to my life? I don't know. Do you like cappuccino? Could you stretch after this radio program? Something teeny, and see if it makes a difference at all, even a teeny difference. So I think that's what I'd like to leave your listeners with. And just to say how much I've enjoyed talking to them, and so delighted of their interest in my book, CBT Made Simple.
That's fantastic. I'm so glad that you joined us today, Nina, and I'm hoping that we'll have a follow-up on this and have the opportunity to talk some more. It has been a great pleasure speaking with you today, and to all of our listeners out there, I just adore speaking with you once a month. It is one of the highlights of my month. Thank you for being interested in what our conversation is and for being part of the solution. For everybody out there, have a gentle day, and I will speak with you again in May. Bye, everyone.
Goodbye, everyone. It was a pleasure.
Thank you for listening to the Bear Psychology Radio Show with psychologist, author, and speaker, Dr. Anna Baranowski, right here on Reality Radio 101.